Hey guys, almost done with phase 2 of learning. We will see what phase 3 holds for us. Today though, or I guess Wednesday, we're gonna go through slides 1 through 10 of the new unit, Unit 8. PowerPoint and notes will be posted to Edmodo. Y'all's assignment for the day is gonna be a worksheet on the different methods of sanitation, because primarily what our unit is on is the method of sanitation. So we'll go ahead and dive right on in because we don't have a ton to do today. That little bar. So there are 3 different kind of categories of sanitation. The first one and the most basic, think of it kind of like a pyramid of like, how clean are we trying to get this place? The first one is cleaning, and that's just like the basic one. That's our bottom layer of the pyramid. Cleaning, you're physically removing any visible signs of dirt or anything else that shouldn't be there, like feces, blood, hair. You're just low basis cleaning, wiping down surfaces, sweeping the floors. The next thing is disinfecting. So typically cleaning is done after each patient. If you want to think about the you want to think about the room where the vet gets to see the patients, cleaning is typically done after each patient is seen. Wipe off the counters, wipe off the floors, make sure there's basically no signs that another animal is here before this upcoming animal. Disinfecting is done at the beginning and the end of each day. Wiping everything down with some kind of cleaner that's going to destroy microorganisms. Because just because you wiped it down, just because you got the hair off, just because you wiped the poop away, doesn't mean that there aren't still microorganisms from that dog's poop right where you had just wiped down. And then sterilizing is really important for like surgery typically, where you want to destroy any and everything that is going to be on that surgical tool, that room, that table, whatever it is. Destroy microorganisms, viruses, all of it. And it can be done using chemicals or heat under pressure, so like the autoclave, where tools are put in to sterilize them at a really high heat and pressure. Skip that. Move on to physical cleaning. Physical cleaning, that bottom layer of the pyramid, done with a chemical, using some kind of chemical with a mop or a sponge. Just a basic disinfectant. Physical cleaning includes dusting, mopping, cleaning up urine or feces. It could be in a room, in a dog's kennel, on the table, like anywhere. Also removing dirt, debris, organisms from the surfaces. And then disinfecting to prevent the spread of those diseases. This is just our bottom, our basic. Let's make sure everything is clean before the next patient comes in. Sterilization. Sterilization is the process of killing all living organisms on a surface. It's going to be done in exam rooms, with the tools, with the tables, the treatment area, and especially the surgical suite, to ensure that the tables and the instruments are free of disease. Make sure that everything is pristine, clean, and when we're helping this animal, we're not going to end up accidentally hurting it in the long run. Cold sterilization is kind of the opposite of the autoclave. With the autoclave, you wrap everything up, you put it in the autoclave, and it uses very, very high heat and pressure to kill any microorganisms that's on the equipment. With cold sterilization, what you do is you soak the items in a disinfecting chemical until they're ready to be used, and then you put them on a cold tray that holds the chemical that's acting as a sterilizing agent. Cold sterilization is easier to do than the autoclave, but the autoclave, like, especially when you use that indicator tape, the autoclave is a guarantee just about that all of your stuff in there got perfectly clean. When you want to make sure your hands are clean, you wash with hot water. If I were to wash my hands with cold water and a ton of soap, even then I would still be kind of concerned. Cold sterilization works, but the autoclave is better at like completely ensuring that the equipment is clean. You can also use dry heat or incineration, where you use an incinerator and you expose it to a flame. So typically this is going to be with, like, if you have an animal that's carrying a very, very contagious disease and it's put down, if it's carrying a very contagious disease, even if it's dead, it's possible that disease can still end up spreading. So the body is typically incinerated to make sure that any traces of the virus, the microorganism, whatever it is dead, and it's not going to be passed on. Everything is burned like straight to ashes. The autoclave is also used. It's a sealed chamber where you wrap everything up, you put it in, you turn it on, and it uses water to heat really, really high to turn into steam so that it kills any kind of living organisms that were or could have been on those tools. You also use radiation and ultrasound. With radiation, using like UV or gamma rays to look at something, or the ultrasound, like in the picture, you're using a high frequency sound wave to kind of like bounce off the vibrations through whatever it is that you're looking at so that you can get an image. And filtration is important for sterilization. Filtration, think of like ventilation. You want to make sure, especially with the surgical suite, that the air is clean. You don't want all this air just filtering through and you lay out your clean, pristine surgical tools and then the air gets on them and microorganisms are there. You want to make sure that the room is very clean, that the air filtering in is clean, that the air going out isn't going to another room. You don't want the air from the surgical suite going to the air with the, or to the kennel room or going to the waiting room. The air from the surgical suite has to be going outside. It's not getting filtered through the rest of the office. And the isolation ward. Isolation ward is where you're going to keep any contagious patients. Think of it as quarantine to make sure that they're not going to be potentially spreading their disease to any other animal staying there. There's separate housing groups, and the items that are in the isolation ward, they don't get moved from the isolation ward to the surgical suite or to the waiting room. They don't get moved. If it's in the isolation ward, that's exactly where it's going to stay because you don't want to accidentally have any kind of cross-contamination. So what you guys are going to do, go back to like the first slide, y'all are going to do a worksheet on the methods of sterilization and cleaning. So what you guys are going to do, there's 3 categories: the types of sanitation, commonly used chemicals, and the methods of sanitation. You guys are gonna, you can use the PowerPoint, you can use the internet, but you're just gonna go through and briefly tell me like, what is cleaning? What is disinfecting? For the commonly used chemicals, you're gonna tell me like, what do the chemicals do? What are they used for? Do they fall into a specific category? Is alcohol only used in disinfecting? Is it only used in sterilization? Is it used all across the board? And then the methods of sanitation, you're going to treat kind of like the types of sanitation, where you're going to go through and you're going to say, physical sanitation is this, filtration is this, cold sterilization is that, so on and so forth. Like it's very straightforward, not a ton of work, but that's what you guys are going to work on for the day. So get to it, get it submitted. Hopefully I will see you guys every Tuesday and Thursday at 1 o'clock for Zoom lunch. Miss you guys a lot. I hope y'all are doing okay. So let me know what y'all are up to. If there's anything I can do to help y'all. Hopefully I'll get to see you guys soon. Bye, y'all.